My name is Stefan Engelter. I'm a professor of neurology with a special interest in cervical artery dissections. I'm working at a university in Basel, Switzerland. The pathophysiology of cervical artery dissection include the interplay of genetic factors and environmental factors. Environmental factors include mechanical factors such as trauma or some physical impact to the head or neck region, as well as inflammation or infection, which can trigger the dissection. And genetic factors, they are hardly known yet, but it's kind of genetic variants which cause arterial frailty, which makes the artery more prone to get a dissection. The best diagnostic tool to diagnose a dissection is MR. In particular, MR with fat-saturated T1 sequences, as it allows us to detect the modal hematoma. This is true also for the carotid as well as for the vertebral artery. But also the ultrasound is of importance because MR scanning could lead to false negative results, and in this case ultrasound is ideal to detect the modal hematoma and therefore verify the diagnosis. Despite the evidence is quite low, I personally would recommend to use endovascular and IV thrombolysis also in cervical artery dissections patients if they have acute or hyperacute stroke, because I think at least we know that we do not harm the patients, although we know that the outcome is not as good as we know it from other etiologies in these young patients. For the prevention of recurrent stroke in patients, I use either aspirin or anticoagulation for these patients. I individualize this question and apply aspirin in particular for dissections presenting only with local symptoms, where I increasingly use anticoagulation for those with presenting with ischemia. But we at least plan a new trial, TreatCut2, to compare both treatment options.